Good morning, my name is Juan Escobar and I'm here to present one of the biggest problems that we're facing as a community here in the Bronx in New York City. I'm talking about obesity, especially obesity in adults. We can define obesity as a weight that is higher than what it is considered as a healthy weight for a given height. To know if a person is overweight or is obese, we should know the body mass index or BMI. The body mass index or BMI is a person's weight in kilograms divided by the square of the height in meters. If the BMI is less than 18.5, it falls within the underweight range. If the BMI is between 18.5 to less than 25, it falls within the normal range. If the BMI is 25 to less than 30, it falls within the overweight range. And if the BMI is 30 or higher, it falls within the obese range. Obesity is frequently subdivided into three categories. Class 1 is when the BMI is between 30 to less than 35. Class 2 is when the BMI is between 35 to less than 40. And Class 3 is when the BMI is 40 or higher. This Class 3 obesity is sometimes categorized as extreme or severe obesity. We should know that the BMI can be used as a screening tool but is not diagnostic of the body fatness or a health of an individual. We, as a future healthcare providers, we should perform an appropriate health assessment in order to evaluate an individual's health status and risks. Obesity is a complex health issue to address. Obesity results from a combination of causes and contributing factors, including individual factors such as behavior and genetics. Behaviors can include dietary patterns, physical activity inactivity, medication use, and other exposures. Additional contributing factors in our society include the food and physical activity environment, education and skills, and food marketing and promotion. Obesity is a serious concern because it is associated with poorer mental health outcomes, reduced quality of life, and the leading cause of death in the US and worldwide, including diabetes, heart disease, stroke, and some type of cancer. Energy balance of the number of calories consumed from foods and beverage with the number of calories the body uses for activity plays a role in preventing excessive weight gain. A healthy diet pattern, which emphasizes in eating fruit, whole grains, vegetables, lean protein, low fat and fat free dairy products, and drinking water, help to prevent obesity. The Physical Activity Guidelines of Americans recommends adults do at least 150 minutes of moderate intensity activity or 75 minutes of vigorous intensity activity or a combination of both, along with 2 days of strength training per week. Having a healthy diet pattern and a regular physical activity is also important for long-term health benefits and prevention of chronic disease such as type 2 diabetes, heart disease, kidney problems, and, of course, obesity. Obesity and its associated health problems have a significant economic impact on the US healthcare system. Medical costs associated with overweight and obesity may involve direct and indirect costs. Direct medical costs may include preventive, diagnostic and treatment services related to obesity. Indirect costs related to morbidity and mortality costs, including productivity. Productivity measures include absenteeism, that is the cost due to employees being absent from work for obesity-related health reasons, and also includes presenteeism, that is the decreased productivity of employees while at work. Obesity in New York. The Bronx ranks 62 over 62 in state health factors. The Bronx has 30% of adult obese. Obesity in New York. The Bronx ranks 62 over 62 in state health factors. 30% of adults in the Bronx are obese. The Bronx ranks 39th over 62 in health behaviors. Obesity in New York. The Bronx ranks 62 over 62 in state health factors. 30% of adults in the Bronx are obese. The Bronx ranks 39th over 62 in health behaviors. Obesity in New York. The Bronx ranks 62 of Obesity in New York. The Bronx has the 62nd place over 62 counties. The Bronx ranks last in 62 counties in state health factors. 30% of adults Obesity in New York. The Bronx ranks last place in 62. Obesity in New York. The Bronx ranks 62 of 62 in state health factors. 30% of adults in the Bronx are obese. The Bronx ranks 39 in 62 in health behaviors. Obesity in New York. The Bronx ranks 62 of 62 in state health factors. 30% of adults in the Bronx are obese. The Bronx ranks 39 in 62 in health behaviors. Obesity in New York. The Bronx ranks 62 of 62 in state health factors. 30% of adults in the Bronx are obese. The Bronx ranks 39 in 62 in health behaviors. The Bronx is the last county in New York in regards of state health factors. Manhattan, instead, is one of the top counties in New York. The Bronx has 30% of adult obesity in its population. Manhattan, instead, has only 16% of adult obesity in its population. In general, the Bronx ranks behind New York State. Overall, New York State has 26% of adult obesity. Instead, the Bronx has 4% more. The top United States performer has the same percentage of adult obesity as the New York State, that is 26%. That means that in the Bronx we need to do something to decrease that percentage. We have to be, if not the top, we have to be the same as our counterparts in New York. The prevalence of obesity was 39.8% and affected about 93.3 million of US adults between 2015 and 2016. The estimated annual medical cost of obesity in the US was 147 billions in the 2008 US dollar. The medical cost for people who have obesity was 1,429 higher than those of normal weight. Hispanics with 47% and non-Hispanics, blacks with 46.8%, had the highest age-adjusted prevalence of obesity, followed by non-Hispanic whites with 37.9% and non-Hispanic Asians with 12.7%. The prevalence of obesity was 35.7% among young adults aged 20 to 39 years and 42.8% among middle-aged adults aged 40 to 59 years and 41% among older adults aged 60 and older. Also, we can say that overall, men and women with college degrees have lower obesity prevalence compared with those with less education. Now, we have to talk about the strategies to prevent obesity. There is no single or simple solution to the obesity epidemic. It's a complex problem and there has to be a multifaceted approach. Policymakers, state and local organizations, business and community leaders, school, childcare, and healthcare professionals and individuals must work together to create an environment that supports a healthy lifestyle. There are several ways state and local organizations can create a supportive environment to promote healthy living behaviors that prevent obesity. Resources are available to help disseminate consistent public health recommendations and evidence-based practices for state, local, territorial, and public health organizations, grantees, and practitioners. Knowing the body mass index, we can help and we can achieve to maintain a healthy weight, and getting regular physical activities also will help to prevent obesity. To reverse the obesity epidemic, community efforts should focus on supporting healthy eating and active living in a variety of settings. The key to achieve and maintain a healthy weight is not a short-term dietary change. It's about a lifestyle that includes healthy eating and regular physical activity. Improving the early care and education environment of child care and early education facilities may directly impact what children consume and how active they are, as well as help them develop a foundation of healthy habits for life. For example, in schools, to reverse the obesity epidemic, schools should focus on supporting healthy eating and active living throughout the school day. Schools can encourage children to drink water in place of sugar sweetened beverage and ensure access to free drinking water as an alternative to sugar sweetened beverage before, during, and after school. Also, schools can ensure that the available food and beverage options are healthy and help the youth eat food that meets dietary recommendations for fruits, vegetables, whole grains, and non-fat or low-fat dairy products. Also, schools can create a local school wellness policy to promote students' health and reduce childhood obesity. Also, schools can increase the amount of time that students are being moderately to vigorously physically active during the physical education classes. And in the community, there are many different types of strategies to increase physical activity. These strategies include point of decision prompt to encourage use of path of trials, individually adapted health behavior change programs, enhanced school-based physical education, and large-scale media campaigns that deliver message by television, radio, newspaper, and social media. They may also include efforts to increase the places where people can be active, such as opening school facilities to public use and creating walking trails. Some strategies may involve community design changes. And in work sites, to reverse the obesity epidemic, workplaces' efforts should focus on supporting healthy eating and active living in their own workplace community. A worksite wellness program that includes a physical activity component can help maintain a healthier workforce. Worksites can encourage physical activities throughout a multi-component approach of offering management support, physical access to opportunities, policies, and social support programs. Also in the workplace, it can be used healthy food service guidelines. Food service guidelines are used to create a food environment in which healthier choices are more available for consumers. These guidelines are used to increase the availability of healthier food and beverage and to display them more promptly so that the healthier options are more accessible. And as a healthcare provider, as a future healthcare provider, I would like to use the relationship with my patients to help them to prevent this kind of problem, to prevent obesity. I would like to use with them the relationship coach player because in this relationship we will work together as a team, we will benefit from this relationship, and we will see goals being met. And as a healthcare provider, also I would like to work with local and state authorities so we can make a plan together and we can include the community. We can share the information to make conscious in the community about what is obesity and what consequence it has. I would like also to encourage or to make a change with the local authorities and state authorities to promote healthy foods and to see what can we do to decrease the price of fruits and vegetables in comparison to fast food, because nowadays, for example in the Bronx, it's more easy to buy like a hamburger, or it's more cheap to buy a hamburger, to buy a pizza, to buy French fries with fried chicken than to buy a salad. It's more expensive to buy a salad, so we can the majority of the Bronx community cannot afford, for example, to have a healthy lunch. They prefer to go to a fast food restaurant and buy a burger with fries that they will cost like $4 approximately, than to buy a salad that it will cost a double. So that will be another focus and another way to incede in this problem. Try to make more available healthy choices so that people can buy and can afford that. As I was mentioning in the previous slides, facilities, policies, and procedures are very important to attack this problem, to solve this issue. In the place where I work, in Montefiore Medical Center in the Bronx, we have different tools so we can use to help patients and help staff to avoid or to prevent obesity. As we all know, hospitals are employers and providers of healthcare and serve approximately more than 6.3 million employees and 481 million patients each year. Hospitals reach a large population of employees and patients and visitors and can have an impact on neighboring communities. This makes them an important setting for obesity prevention efforts. Hospitals can create policies and environments to encourage healthier food and beverage choices, increase physical activities, and support breastfeeding lactation. Like I was saying, for example, in my workplace in Montefiore, we have different tools, and that's not the only hospital that has those tools. I think, well, in my experience in New York State, and especially in New York City, all the hospitals have those tools to promote healthy lifestyles, to promote healthy food, and to prevent obesity. In this hospital, in the city hospitals, they provide healthier food and beverage options. They provide opportunities for physical activities, especially in my hospital. We have a community center. It can be used with, it can be used for patients, and it can be used by patients, and it can be used by employees. We have different areas for patients and different areas for employees. But in those areas, you can exercise. You have weights. You have bicycles that you can exercise every day. Also, we have tobacco-free spaces and breastfeeding and lactation support, and places where patients and employees can lactate their kids. So that's all. Thank you so much for your attention. I hope that you enjoyed this presentation. I hope that we can make an effort, and we can make an effort as a community and as a nation to prevent this problem. What I like about this class is that this class gave us the tools, the courage to make a change in our communities and in our nation. Thank you so much.